Evidence-based medicine has become one of the most misused terms in healthcare. It gets used like a credential, and it was meant to be a process. The original framework had three pillars: the best available evidence, the clinical expertise from years of practice, and the patient's values, goals, and context. Real evidence-based practice lives at the intersection of all three. The problem is the phrase gets weaponized in both directions. On one side, you have influencers and creators leaning entirely on anecdote, personal results, N=1 cases, and that's not evidence. That's experience with no verification. On the other side, you have medical practitioners from academic medicine saying that if something doesn't have a randomized controlled trial or meta-analyses, it's not real evidence. And that's also wrong. RCTs are powerful, but most clinical questions don't have one. Waiting for level 1 evidence on every question you'll never get an answer to is its own form of bias. The actual practice is threading that needle. Sometimes you over-index on the literature when the data is strong, and other times you over-index on the clinical experience when you're seeing a pattern that the literature hasn't caught up to. And always you check it against the patient in front of you, their goals, their values, and the context of the situation. So evidence-based isn't a position you take, it's a discipline keeping all three sides honest.